Hello, and welcome to a special Veterans Day Town Hall with your Secretary of Veterans Affairs, Dennis McDonough. I'm Marine Corps veteran Jose Llamas and a Veterans Experience Office employee here at VA Central Office. Welcome, Mr. Secretary.
Thanks, Jose. Great to be with you.
It's always great to have you. Sir, it has been quite the 2023 for VA.
Yeah.
We have we have a new Deputy Secretary, the first woman who's been confirmed in that role.
Yeah.
PACT Act has been implemented, a new inclusive mission statement has been adopted,
Yeah.
and VA trust is up.
Yeah.
What has 2023 meant to you, or better, what has it meant for our veterans and their families?
Yeah. Well, I think you asked the most important question, Jose, which is what does it mean for veterans, their families, their caregivers, their survivors? And I would point up two things. We like to think that this is an organization that works for vets, right? So what does that mean? It means that we have to make sure that veterans can come find programming from us easily. They don't have to change their life to learn about it or to get it. We have to fit our programming into their lives. You know, veterans are doing amazing things across the country. You can't just drop everything and come on our timeline to our facilities to get what they've earned and what they deserve. Right. So this is something I've learned from you and from John Bursler, the two Marines down there in VEO. And so one thing I want to highlight about 2023 is I hope veterans who hadn't heard from us in a long time or hadn't ever heard from us, heard from us. In July, August, September, October, we instituted an outreach plan to veterans not connected to us, but who we know, based on their service, are eligible for the new benefits under the PACT Act. And we did something revolutionary for VA, but pretty commonplace for everybody else. We, for the first time, used text to reach veterans, to encourage them to take a look at VA. The VA care and services and benefits that they've earned already. So 2023, I hope for our veterans, was a year that they heard from us and that they saw our programming, our benefits, our care, which is their programming, their benefits, their care, in a much more usable light. But we'll get into that in the questions, I know. That's one. Two, we also increased the number of veterans enrolled in VA. That outreach, VA for healthcare, that outreach in those months was really important in getting claims filed. Almost 2 million claims filed in the last fiscal year. It's 40% more than the last year, which was the highest ever.
Incredible.
But we also have more than 400,000 new enrollees in VA healthcare. In one state, there was 4,000 new enrollees in August alone, right? So that's great news, provided we're ready for them when they come in for their care. They don't have to wait. So anticipating that, we had a very, very good hiring year. Hired more than 61,000 new employees at the Veterans Health Administration. We have now, for the first time ever, more than 32,000 employees, including, importantly, claims raters at the Veterans Benefits Administration. So we had a very aggressive hiring year so that when we reach veterans and they decide to come in, we're ready for them. We don't make them wait. So I hope that continues into 2024.
Yeah, it was quite the summer doing PACT Act outreach.
Yes.
And it was successful, as you just mentioned.
Yeah.
So many people really got involved, let veterans know that this was out there, and we let the families know that it was available to them as well. And look, you just mentioned it. Like, we had so many veterans come and see us.
Yeah. You know, more than $2.4 billion in benefits have already, and let me just actually modify that correctly. More than $2.4 billion in earned benefits, are now in the appropriate place. That is to say, with the veterans who earned them by virtue of their service. And one of the things that we know, and we've talked about this on in this setting before, Jose, which is a lot of our vets out there, they're warriors, and they've been living their life with that warrior ethos that says, you know what, I'm going to care for my battle buddies first. I'm going to care for my unit first. You know, I'm going to eat last. And that translates sometimes to those benefits should go to somebody else. They're not for me. But what we've been communicating this year is A, they're benefits you earned by virtue of your service. B, they benefit you and they benefit your family, as you just said. And C, the more we know about your service, the more we know about the men and women in your unit, the men and women in the unit that relieved you, the men and women in the unit that you relieved. So when we have that information from you guys, yes, it helps us serve you, and it helps us serve your family. In some cases, through our pension program, helps us serve your family after you're gone, and it helps us get a more complete picture about your battle buddies. And therefore, your act of coming in and filing a claim is consistent with that ethos that says, hey, I'm more worried about my battle buddies than I am about myself.
Yeah. Buddy. You mentioned the word buddy. We did the buddy check a couple weeks ago, too.
Yeah.
Another great event that we put on, reaching out, letting veterans know what was available to them.
Yeah, and it's one that we learned, this isn't our idea. Right? We learned this from the VSOs, from the Legion, from the VFW, from DAV, and we learned it from vets themselves, because this is what vets do, right? But we also know that sometimes, as much as vets are going to reach out and help each other, they aren't going to necessarily acknowledge that they need a little help too.
Exactly.
That's human nature, but that's also the nature of vets who spent their life giving, sacrificing, serving. So the buddy check was permission structure to reach out, and then we see the virtuous cycle that results from it. So you're right, it's been a busy time.
It has been. It has been. Well, Secretary, today I'm going to ask you questions that were submitted to us by veterans and caregivers from around the country through one of our VA great partners, Rally Point. And they asked a lot of questions, ranging from travel reimbursement to memorial benefits. So let's just get into it and just answer these questions. Huh?
Yeah.
All right, bud. The first question comes from Navy veteran Lieutenant John Bistroff. And John asks, why is it so difficult and takes so long to increase a disability rating?
Look, it's a great question, John, and we saw progress over the course of this last fiscal year, FY23, and for example, even though we had almost 2 million claims filed, 600,000 claims reviewed under the PACT Act alone. We still did those on average 20 days faster than last year, right? Now, so that's 20 days faster and every day matters, but it's still, all told, on average takes about 125, 126, 27 days. That's too long. And so the second thing I'll say is, we're working on it, we're getting better. But the second thing I'll say to John is, I hate that you have to wait. So this is why we began hiring as aggressively as we did in FY21. So 2 years ago, we could see around this corner to say, hey, you know what? We are going to get this law passed, and make sure that our vets exposed to particulate matter throughout Central Command for 30 years of war can finally file a claim. And, you know, we think there's 4.5 million people, vets, who were in Central Command in that period. So we needed more people. So we've grown the VBA workforce by about 25%.
Incredible.
So that's good news. That's why the numbers are coming down. But they're not coming down as fast as they will yet because those folks are not all yet trained. There's a training tail of about a year, right? So that is to say we hire that claims rater. That person has a year of training before they're producing at the rate an experienced producer will produce at. So we need a little bit more time yet. Our processes are getting better, including by the use of certain technology, including automation. So that's going to help this get faster. But the bottom line is, any day a vet has to wait, any day, John, that you have to wait is, we regret it deeply. And we're working to reduce that time. But, and this is my last point, what we won't do is rush to a quick no when extra work, extra evidence, extra research will get us to the right answer, which is yes. So we want you to get that claim, that increase, the disability rating increase that you've earned. We want you to get that quickly, timely, and we want you to get it in high quality with the right decision. You know, Jim Jones, another Marine, used to say to me, when you want it bad, you get it bad.
That's
right.
True. Yeah.
So we want it good, and we're going to get it good. Hiring, improving our processes, being responsive and communicative with our veterans, we're going to get this better.
Yeah. And for those who are watching, if you do have questions about your benefits, the number to call anytime is 1-800-MY-VA-411. And there's folks there that can help you out and answer the questions if you have further questions.
I just want to say one other thing to John, which is, it's a great question. I'm really glad you asked it. Please, you, John, everybody else watching, if you're frustrated on the timeline, you don't need to wait till the next time we're talking to raise your concern. Get with your member of Congress. Believe me, I'm talking to them all the time. I'll be going to see our chairman, another Marine, later this afternoon. Get with your VSO. You know, get with us through 1-800-MY-VA-411. One of the things we do aspire to do is to communicate more regularly with you, so you're not waiting in the dark. But also don't wait. If we can help, give us a holler.
Yeah, great point. Let's go to the next question that was sent to us by Army veteran Corporal Michael Urban. And Michael asks, why is it so hard for us to get community care referrals when care is not available at VA?
It's a great question, Michael. Thank you for that. A couple things. We have, since I arrived in VA over the course of the last 3 years, we've seen the amount of care we provide in the community grow by about 15 or 17% a year, right? And so this is not only is care in the community really critical to good health outcomes for our veterans, it is an increasingly large part of the care profile that we offer. So much so that 40% of the care we offer today through VA is offered in the community. Secondly, commensurate with that is our trust scores. You said in the opening, Jose, that trust is up. Trust is up on care in the community. it's this year was an average of 85.3 out all three vectors. You know, timeliness, effectiveness, and emotion. That's really important. So care is up. It's really important part of the care profile we offer, and satisfaction is growing. But you're clearly not satisfied, which is why you asked the question. And so the question is, why is it sometimes hard to get referrals? It could be a range of issues that include that the care, in many markets, the community is frankly even more saturated than VA is. We're trying to make sure that we have better data. So you, Michael, and other veterans who are getting referred to the community can make an informed decision about, you know, if you have to wait more than the 20 days for primary care in VA or more than 28 days for specialty care in VA, which is what the law requires. If you go over those time limits, we are required to refer you out to the community. But let's say, you know, your options in the community, especially with specialists right now, are no better, all right? We might be able to give you more information to help inform your decision. So one, the community market, the market where we're referring you might be overpopulated. Two, our processes still may be sclerotic. And even though we're moving 40% of our care through the integrated veteran care system, there are still places where it's maddening. And I know that it's maddening. And it's maddening most importantly for you. But also it's maddening for example, our MSAs, right, our medical support assistants who really make the VA run. And we just have to tighten those down, right? Then lastly is we just have to get better about providing care in-house.
That's right.
Right? We know study after study shows that vets who get care in the VA actually have better outcomes than vets outside of VA. It's because we integrate the care. We also know now increasingly that veterans, we in too few cases actually get the record of that veteran visit in the community back into your medical file. So we can't integrate the care. We can't know what came out of the visit to help our vet manage it. The Inspector General said in 75% of cases. So 75% of the cases, in 40% of the care we provide, we don't get the record. That's not us being good stewards of our vets' health, of your health, Michael, or anybody's health. So we have to improve our processes. We have to integrate this care better. And we have to make it easier for you to stay in-house when you want to stay in-house, right? Because we know you do better there because we integrate the care better. So, great question. It pains me to know that it's hard to get the care. This is my first point I said a minute ago, which is we want our programming to fit into your life. We don't want you to have to drop everything and, you know, or you have dropped everything and you've planned for a visit to a VA and then out of the blue you get canceled without an explanation. All of those things were working. I hope you are feeling that those kind of nettlesome, frustrating experiences you've had in the past become a thing of the past. And I'm hoping that 85.3 trust score on community care is evidence of that. Yeah. And now that we've had such a good year hiring, I hope we can keep more of our vets in-house.
Yeah. And something we've mentioned in the past when we've sat together, and I think it's something worth repeating to veterans who are watching today, and maybe the first time they've seen you speak, that VA is one of the best places to go for healthcare, yeah, compared to the private sector, yeah, in most communities. Yeah. And I don't think that a lot of veterans realize that we are providing top-notch care. Yeah. Right? That's super important.
Yeah, look, I mean, there's just a study a couple of months ago, survey, a collection of 40 separate surveys. So it's a survey of surveys. And they looked at care between 2017 and 2023 for veterans. And they looked at these surveys of that care in that time period. And the conclusion in that study was, in all cases, VA care is at least as good as the care in the community, but in many cases better. So I repeat that. From 2017 to 2023, during the pandemic, care provided to veterans was at least as good as, and most cases better than, care in the community. That doesn't mean in every case, and I know I'm not trying to say that Michael isn't right to be frustrated, because I guarantee he is.
Sure.
But we want you to know we are providing excellent care. And the other thing we want you to know, I thought this might be where you're going, Jose, and it's, I want to just pile on it, is we want you in our care. I want you to know we want you in our care. I want you to feel that we want you in our care. We want you to feel that we're building our programming for you and in a way that fits into your life. And when we've succeeded in that, then we can feel good about what we're doing. Until we've done that, we don't and won't.
Agree. The next question, we actually received a video, which we're going to roll to, from Kim Scofie from the United Military Care. And she's going to ask her question of you.
Great.
Hi, I'm Kim Scofie, President of United Military Care, a nonprofit in Georgia that's been taking care of veterans since 2012. Behind me is the Aviation History and Technology Center in Marietta. Today we're coming to ask you a question about the code that covers the HUD Vash grants for homeless veterans. I'd ask that you review the code and the statute that covers it to determine if hotels and extended stay motels can be added to receive HUD Vash vouchers, allowing homeless veterans to come off the street earlier while they search for permanent housing over 6 months.
Excellent question. Look, this is, we've been talking about VA so far in this discussion, Jose. One of the principal reasons VA has the kinds of results that we have is because of partnerships with organizations across the country, precisely like this, right? And so it's a great question, one. Two, I will review the statute and I will review the specific question. As you know, the idea, so I'm not trying to explain this to you, I want to explain it to all the other viewers. The idea we have is that we have two other really important programs. One is called Grant and Per Diem. The other is called Supportive Services for Veterans and Their Families, so GPD and SSVF. Those two programs, which we've had funded at historically very, very high levels during the course of the pandemic and in the year since the pandemic has begun to subside, we have used those cash programs to make sure that we get vets into what are, traditionally considered transitional housing settings, hotels, motels, and other settings. And that the HUD Vash vouchers are then meant to be the vehicle to permanent housing. And that's been a really important way that last year in calendar 2022, we permanently housed 40,400 vets. We set a goal again this year in calendar 2023 to permanently house 38,000 homeless vets. We are on track to meet that and exceed that goal again this year. The HUD Vash vouchers are a critical part of that. So it's a good question. I will look at it. And at the same time, I want you to know that we're trying to get additional funding. And by the way, we get a lot of support from the White House and from the Hill on this. Republicans and Democrats on the Hill giving us a lot of support. So we'll try to do three things. In addition to reviewing the statute, I'll also make sure that we're continuing to fight for more Grant Per Diem, more SSVF, and more HUD Vash vouchers. Last point about this. Why is the HUD Vash voucher so important? The HUD Vash voucher, which is specifically designed for vets, allows you to get the veteran to get a monthly stipend for rent and to get the supportive services at their VAMC or at their CBOC to address, or at their vet center, to address the issues that led to homelessness in the first instance, right? Substance use disorder, involvement in the justice system, untreated PTS. So at VA, we not only get you into housing, including into permanent housing, but we also get you access to the care that, again, you've earned, and that will allow us to address the issue that led to the homelessness in the first instance.
Yeah.
So great question, Kim. Thank you very much for it.
Well, I know homelessness is a big issue, concern of yours. I know that you're very involved, and people may not know this, but I know that you are involved in actually going out to the pit count, right?
Yeah.
The point in time count, where we go out and we count out in real time how many homeless veterans are out in the streets in a particular evening. So I know it's important to you, and I think viewers should know that you're involved and you're going out there and doing it with your fellow VA employees.
Look, I mean, you're generous to say that, Jose. I mean, I think everybody watching knows I'm not a vet. And it's really important to me to be the secretary of a VA that puts vets at the middle of every decision. And I think traditionally the great VA secretaries we've had in the past are vets, and therefore they can empathize with what veterans experience in life. Makes them better leaders. We all know that, right? Empathy is a great strength of every great leader. Mm-hmm. Well, I'm not a vet, so I can't go to that. But I'll tell you what, on things like this, on vets experiencing homelessness, unfortunately in all of our cities, including right here in Washington, D.C., we don't have to walk far to find out and to witness and to experience what those homeless vets are going through. So it is a unique opportunity for me to get that experience, to get the experience of seeing what our guys are going through, our men and women are going through, so that I come back kind of powered up to get this thing done. Last thing I'll say is I continue to believe that the phrase homeless veteran should not exist in the United States of America. That anyone who swore the oath to give everything for us, to be on the street tonight, is, to my way of thinking, unacceptable. And so that's why I'm so proud of the team here, working with our partners like Kim to ensure that vets aren't in that situation.
Yeah, really important work. Let's go to the next question from Air Force veteran, Senior Master Sergeant Carl Spatz. Carl asks, I'm a veteran who lives too far from a VA National Cemetery. I want my family to be able to visit me posthumously. If they choose, what options do I have?
Awesome. Carl, thanks for the question. And so the good news, and I just want to make sure, Carl, that you take advantage of, you know, on the lower part of the screen here, you'll see a website that is maintained by the National Cemetery Administration, NCA, which is one of our 3 administrations here inside of the Department of Veterans Affairs. And if you go to that site, even while we're talking now, I think you'll get more data that can help you. If that site is not, does not answer the question for you in terms of options closer to your house, call us at 1-800-MY-VA-411, and we'll, in real time, get you additional data. That's first point. Second point, we have, at VA, we not only run the nationwide system of national cemeteries, but we also work with the states and we work with tribes to make grants to the states and tribes when they maintain their cemeteries. So, you know, in Minnesota, for example, the state just opened a new state-run veteran cemetery in Glenwood Falls, which is kind of southwest of Minneapolis, a little bit. So we have in Minneapolis, I'm just using this as an example, we have Fort Snelling National Cemetery, which VA runs. And then in Glenwood Falls, we have the State Veteran Cemetery, which the Minnesota State runs, but we help fund. And how do we do that? Well, we ensure that our veterans have the burial benefit so that we can ensure, Carl, that you have a resting place that is dignified and a lasting tribute to your service to the country. But we also then give a certain amount of money to the state of Minnesota to finish the building of that cemetery, or in some cases expanding that state-run cemetery. And we give a per veteran allotment to them for maintenance of the facility. That infrastructure of national cemeteries plus state-run cemeteries plus tribal-run cemeteries has allowed us to accomplish our goal of having, or nearly accomplish our goal of having more than 93% of veterans have a cemetery within 75 miles of their home. So you didn't specify the distance. We use 75 miles as the best proxy for a reasonable time for our veterans' families to travel. So that's our goal. We're not there yet. I think we're at about 93%. We want to get to 95% of veterans. We'll keep working on this goal. Carl, I'll ask you to again go take a look at that NCA site. And if your questions aren't answered there, please do call us at 1-800-MY-VA-411.
Yeah, really important for veterans to know out there that they do have that benefit available to them, especially for family members who are watching today, that benefit is available to your loved one. As the Secretary mentioned, please visit the website, learn about the end-of-life benefits that we offer, but even better, that our national cemeteries are national shrines. Like,
Amen.
They are spectacularly beautiful and well-maintained.
It's amazing, it's always so moving to go to our national cemeteries. That you're right, they're national shrines. One of our colleagues, his name is Ed Ledford, he has a really beautiful way, or a beautiful phrase. He says, with the sweep of an eye, you can see that freedom is not free. You see the price of freedom. And when you go to the national cemeteries, you not only do that, but you also then see the meticulous care that our NCA colleagues and employees, teammates invest in our national cemeteries. It's why that, just this year again, they scored highest on a rating of customer service among all organizations in the United States. Private companies, public organizations, nonprofits. NCA scored highest on customer service than any of them. And you see it there. And just one last thing is, relatively few of our vets are actually aware of the burial benefit.
That's right.
And so what you'll be hearing from us over the course of FY24 is a very concerted effort to work across our enterprise, across VA, with the National Cemeteries Administration for sure, but also with the Veterans Benefits Administration, which will talk and update vets about the pension options they have. And then, of course, the Veterans Health Administration will be talking about the end-of-life benefits that we have, including the relative simplicity that you can now, that a veteran and a family can now get what we call pre-need authorization for the burial benefit. So as you're planning, your family doesn't have to, the veteran's family doesn't have to wait until that moment, that very sad moment when we lose our vet, but we can actually plan now. And you can see what you qualify in terms of those benefits just through the click of a few buttons so that you are ready for that moment when it comes.
Yeah, very important step to
Definitely.
take. The next question is going to be submitted by a video from Captain Blake Bourne, Army veteran from Bridge Home.
Sir, this is Blake Bourne from Veterans Bridge Home in Charlotte, North Carolina. Appreciate this opportunity. We're here at Accenture headquarters for a veteran event. I wanted to share a few things and ask you a question. First of all, thank you for what your teams do every day. We have phenomenal relationships with VISN 6 and VISN 7 here in the Carolinas. And grateful for what we do alongside your VA teammates. Would love to invite you to come down to the Carolinas and see one of our 200 events. Last year we supported over 20,000 veterans and military families through those events. Would love for you to join us. But finally, sir, my question is really excited about the VA's interoperability pledge. My question is, how do you translate that with healthcare systems into community-based organizations, especially those that are involved in the suicide prevention grant, Staff Sergeant Fox grant? Thank you very much. Be the bridge.
Awesome. I've gotten a chance to visit Bridge Home with Blake, and I was in Charlotte relatively recently. He was there with a bunch of our veteran VSO partners, our community partners. Independence Fund was there. It was really great conversation. I also, the first year I was in this job, visited Charlotte and was able to join a Bridge Home event to see them in action. Again, it's partners like them that allow VA to do what we do. The interoperability pledge, what Blake is referring to, is an effort undertaken by Dr. Elnahal to ensure that our VA hospitals and clinics, working with our community partners, use existing record transfer portals. We don't have to create anything new. We just have to make sure that we're all using what's already available to us to get those records of VA care in the community back into that veteran's file. And so our interoperability pledge, easy for me to say, is just us saying to our community partners and they saying to us, yes, we're going to use those technology-based digital systems. No more faxing back and forth. Can you believe we still have faxes in our system?
I know.
No more like, hey, I'm going to put it in the U.S. Post. I love the U.S. Postal Service, but you know what? Let's just use the existing digital infrastructure. So that's what the pledge is. The second thing I'll say about this is, imagine when we get the electronic health record then modernized, right? Mm-hmm. So we update the VA VISTA system to a system, conceived and launched in the 21st century. That's going to only have a beneficial impact, an even greater beneficial impact on this interoperability. Last point is interaction with our community partners, including recipients of the Fox grants. The Fox grants, which Blake referred to, are for the first time, we've just finished our second year now. So this is the first time of making grants to local community organizations. We made 300 such grants this year. These are grants to organizations in communities around the country, in every state, of organizations that know their veterans best. And what the program is saying, what the Fox grant program is saying is, we're going to invest in local organizations who know their vets best to do innovative things to identify vets and support vets who are struggling, so that we break this suicide crisis. So that inevitably will build the kind of network that Blake is talking about, right? and so that we can get into a position where we're sharing information. But I also want our vets to not think that somehow we're sharing their health information with grant recipients, right? Your relationship on your health care is with us. We don't share your health record with the Department of Justice. We don't share your health record with community partners. Your health record is your record, and we guard that with utmost seriousness. So when you come in to get care, you can have every confidence that we will protect your privacy, that we will act with absolute discretion. Because the most important thing is your care and the outcome of that care. And we work for you. We don't work for anybody else. We work for you. So yes, when we built this network of organizations on the local level, who through equine therapy, through recreational therapy, through faith-based stewardship and community building. When we're doing all that, yeah, we're going to create a network that says, hey, we're looking out for vets. But what we're not going to be doing is sharing your records. So don't worry about that. I hope I've made the distinction there, Jose. I just want our vets to know your healthcare record sticks with us, doesn't go anywhere.
Yeah,
because
important.
we work for you.
Mm-hmm. And we do have a huge veterans resource community network throughout the country. In my office, VEO, we are working with them through many means to share information. So everybody's on the same page. Everybody knows what VA is doing, and they're sharing it with their veterans in their community.
Yep.
Right? So
absolutely.
Super important.
Blake, Bridge Home's an impressive operation. I was really happy to see him on the screen.
Yeah, Blake and his team, they're great.
Yeah.
So we have two questions, and I'm going to ask them both.
Yes.
The first one is from Air Force Staff Sergeant Jeffrey Shizblick. He asks, when will VA propose a rule to allow for gender confirmation surgery? And then the second one going into it is from Lieutenant Commander James Larson from the Coast Guard. And he asks, why is VA wasting resources on abortion and transgender concerns?
It's great. Really good questions.
Yeah.
Two sides of the same coin in some way, right?
Mm-hmm.
Two different sides of the same coin. So we have our suite of healthcare services that we offer at VA. And these are obviously paid for by the taxpayers. So we want to make sure that, and the policy and the laws require that, we publish the services we offer. And when we want to change the services we offer, we have to do rulemaking, right? So the first question is, hey, you announced in the summer of 2021 that we're going to provide gender confirmation surgery. When are you going to publish the rule that will change the suite of services and thus allow us to begin doing that? The reason we do that is not only do we have to be accountable to the taxpayers that this is the service we provide, but we also want to make sure that as we change it, the rulemaking process is a very public process. So we have the informed consent, and we're informed by the expertise of the American public, right? Docs, nurses, policy experts, as well as individual citizens sharing their views. So that next step on the rulemaking is with me now. I've said publicly many times that I will be the one to defend that decision when we make it. So I'm going to make that decision when I'm ready. And for a lot of different reasons, I've determined that I'm not yet ready to do it. But I will do it. So that's the answer to the first question. When will you do it? I'll do it when I'm ready. I'm not yet ready. I'm working this really hard. The second question is, why are we wasting resources on abortion and on transgender concerns? So let me set aside abortion for a second, and let me just say, let me tell you the story about why I made the announcement in 2021 that I did. And the reason I made the announcement is because it came to me as a uniform recommendation from our clinicians, our docs and our nurses, that we do it. And I was really obviously interested in that decision, in that package, but also kind of surprised by it, including I was surprised by the unanimity of the recommendation. And I've made a couple of points to our docs here and to our nurses. The most important one is I am not a clinician, so I'm not going to be making clinical decisions. I'm going to support our docs and make sure that I am running an organization where we can transparently make decisions about veterans and health outcomes that are informed not by political considerations, but by clinical decisions and considerations alone. So what were the clinical considerations in this? And one thing really sticks with me. Untreated gender dysphoria is among the leading causes of suicide. And I assume that that simple fact, that simple but troubling fact, is one of the reasons that our clinicians feel as strong as they do about providing this service. Which brings me to my last point. When the president called me and told me to take this job, I've told this story before, I've told you this story, including in this setting, in Thanksgiving weekend 2020. He said, you know, the job is very simple. The job description is very simple. He said, your job is to fight like hell for vets. And I was sitting there with Kari, my wife, and he also said, well, Kari, you know, we like Dennis, but we love you, so we hope you guys will do this, you know, because he actually knows my wife knows stuff, right? But I've thought a lot about that job description. He didn't say, hey, Dennis, it's your job to fight like hell for some vets. He didn't say, fight like hell for the straight vets or fight like hell for the gay vets. He said, fight like hell for vets. And so, that's how I see this question, which is, are we doing everything we can, including in cases where, for example, untreated gender dysphoria leads to suicide, to take care of all vets, every single one of them? I've said time and again, I'm not a vet, because I'm not. When you are, you earn the benefits and the care that we offer at VA. It's my job to make sure that what you've earned, you get. And that's what I'm going to do as long as I'm here.
And you are. I've personally seen you on the road.
Yeah.
I've seen your compassion talking to veterans and their caregivers. And I want veterans to know that you mean what you say.
Yeah.
I've seen it.
Oh, thanks.
Yeah.
You're generous to say that.
Well, let's go to our next question.
Yes.
The next question comes from Fireman Stephen Mandracci from the Navy. And his question is, are illnesses that are service-connected but under control with medication be revisited by VA automatically? Will Agent Orange victims that received lower ratings, such as 10% or 0%, have to refile in order to receive fair compensation for life-threatening conditions?
This is like a great question. And, you know, I've heard this from veterans across the country. Stephen, a family name of mine, in my family too, the name Stephen, I like that name a lot. This has been, in particular, an issue under the PACT Act. And Josh and Sharif and I, Josh Jacobs, the Undersecretary for Benefits, Sharif Elnahal, Dr. Sharif Elnahal, the Undersecretary for Healthcare, had a discussion about this earlier this week, in fact. What we've seen in the context of the PACT Act, which says, hey, if you're a Vietnam vet, you're exposed to Agent Orange, and today you have hypertension, your hypertension is now understood to be service-connected. Not only understood, but presumed to be service-connected for purposes of benefits. In a very high number of cases, including perhaps Stephen's case, or surely somebody that Stephen knows. There's a veteran who has hypertension, it's being treated, and therefore they received a 0% or a 10% service connection. And so we've become aware of this over the course of the last year. We're digging in really hard on this question, which is, hey, is that really the right outcome? And if it is the right outcome, aren't we creating a weird disincentive where, for example, a veteran who is treating his hypertension before he goes to the CMP exams stops treating his hypertension, right? We would not want that. So VHA and VBA, in fact, just met last week. Our CMP examiners, along with the cardiologists and the cardiac experts at VHA, to answer some additional questions about Steve's question. So I don't have an answer for you yet, Stephen, on whether it will be revisited automatically. That is precisely what we're considering at the moment, based on this year of lived experience under the PACT Act. But we will update you as we get in a position to make further decisions on this. But I really thank you, and I really thank you for raising the question, and I want to reassure you that we're working it. Now, maybe that's not much reassurance because you're like, well, whatever, then just fix the damn thing. I get that. So, you know, I'm not trying to say like everything will be fine. I'm just trying to say we are getting to the bottom of this, and we will make some decisions about it. Last point. Those veterans out there who are thinking about filing a claim and may be deterred by this experience, please do not be. And those of you who filed a claim and got 0 or 10%, please remember that there are benefits to your so being or so having a service connection. I'm not saying that it's the end of the line and we're going to keep working this issue, but if let's say you got 0 or 10%, you may also then have gotten related service connection ratings. And you therefore may qualify for additional benefits, or someone in your family may qualify for additional benefits. And lastly, even at 0%, if you die from that service-connected disability, your spouse is eligible for pension, which we call DIC. And so the service connection, even at 0, and again, we're reviewing that, and I'm not saying it's the end of the line, we're reviewing that, but even at 0, there's important benefits for you. So thank you very much for asking the question, Steve.
Yeah, really important question for a lot of veterans out
Definitely.
there. Yeah,
definitely.
Let's go to the next question. It's from one of our partners in the community. It's another video. It's from Autry James, Coast Guard veteran with the American Legion.
Department of Veteran Affairs advises veterans not to use claim services from unaccredited parties. What is the plan for the VA to work with veteran service organizations such as the American Legion to educate veterans on these parties and to fill the needs for claims services in efforts to help our veterans before they are taken advantage of by these unaccredited entities?
Awesome question, and thank you again. Thank you for our partnership with the Legion. Autry, thank you for the question. The first thing we're going to do is continue to talk about this. I was just out there again this week talking about the risks that our vets face from these claim sharks. And I just want to remind everybody that no one can charge you a fee to file your first claim with VA. They just can't. It's against the law. Now, we have a proposal before Congress to try to strengthen that law And I know our VSO partners support that. And we're hoping that Congress takes that step to give some greater leverage to our shared goal of holding to account bad actors who try to trick vets into thinking that they need to pay someone to get the veteran's benefits that the veteran has earned, right? You don't need to pay anybody for that. So the first thing is we want to strengthen the laws to make sure that we can hold these guys to account. Second, there is a big education component here, which is we want to make sure our vets know what they can and can't do, and we really want them to know that there are a massive amount of resources available to them to help them file their claims. The Legion is one example. DAV, VFW, Vietnam Vets, Wounded Warrior Partnership. Every county in the country and every state in the union has veteran service officers. Those officers work for you. They're not motivated by profit or anything else. They work for you. They're trained. They're experienced. And what they work with you to get is your earned benefits. All right? So we have our principal vehicle, which we have stood up over the course of the last year, is an interdisciplinary multi-agency effort called VSafe that allows us not only to share information with veterans and to educate veterans and to partner with VSOs in both sharing of information and educating veterans. It also allows us to work with the enforcement agencies in the U.S. government. I was recently down in North Carolina, as I mentioned a minute ago in reaction to Blake's question, and we led a conversation among VSOs in that local market with the Federal Trade Commission, with the Security Exchange Commission, with the Consumer Finance Protection Board, CFPB, to make sure that those enforcement agencies have information about bad actors so that they can make sure that we're using those enforcement powers to stop those bad actors. Lastly, there's more we at VA can do too to make sure that vets do not get so frustrated with their experience with us that they say, well, forget it, the experience at VA is so nettlesome, so slow, so sclerotic, that my only option is to hire somebody. And this goes back to the first thing we talked about, Jose, which is we have to ensure that we are building our programs into the life of veterans. Not that we're expecting veterans to change their lives to fit into our schedule. And so we just have to make sure that and it goes back to the first question asked, which is why is it so hard and why does it take so long to get a darn claim? And so 20 days, year on year, that's good. It's a start. We just have to do this better, faster, and higher quality. And that's our pledge to you, which is not only will we educate veterans, not only will we work with our federal partners, not only will we work with our VSO partners to make sure vets have what they need, but we're also going to make VA better so you don't get so frustrated that you say, well, forget it. My only option is to hire, Dewey, Cheatham, and Howe, and that's what I'm going to do.
Yeah. It's confusing for some.
It is.
A lot.
Well, it's confusing, but it also, the confusion we can take out of it, the other thing we got to take out of it is the slowness.
Yeah.
Right? And the lack of communication. Those things we control.
And more information to come forward in the months to come from us. And I know we're working on that right now.
Yeah, keep your eyes out on VSafe.
That's right. All right, let's go to the next question from Major Robert McGowan of the Air Force. And he asks, at our clinic, doctors come and go. Do you have a plan to stabilize the situation?
Yeah, this is Robert, this is something we hear about in a lot of different places too. we just had a really tough Inspector General report on us. By the way, the IG, critical partner for us, is a really important tool to hold us to account, to make sure that we're living up to the really high standard that you expect of us. And if you see something that smacks of waste, fraud, abuse, lack of responsiveness, you'll see at the bottom of the screen here, contact data for the Inspector General. Please make sure that you open a line with the IG if you see something that doesn't strike you as right. But a recent report from the IG said that one of the real risks for us on mental health care is the lack of continuity of care with one provider. And I could give a whole list of reasons, many of them very rational and justifiable, why that's the case. But those would just sound like excuses. So I want to just say to Robert, everybody watching, that we recognize that the turnover in providers, particularly the turnover of providers in mental health care, is a major challenge for us. This is why we made FY23 the year of hiring, because we knew we had to get ready for the influx of veterans from the PACT Act, and we have to get better about continuity of care. Mm-hmm. So we hired up. We're in a much better position now. The other thing we did is any good hiring strategy starts with an aggressive retention strategy. So when Congress passed the PACT Act, we asked for a series of pay authorities and bonuses, for example, bonus structures, to allow us to better pay those providers who are high performing. Right? And so that retention, those retention bonuses, those relocation bonuses, those critical skills incentives, those all become really important to retention strategy. Lastly, if any good hiring strategy starts with a retention strategy, any good retention strategy starts with getting rid of those we should not be retaining, getting rid of the low performers. So we've taken that deadly seriously. And everybody knows that it's more difficult when you're working in the federal system. There's a lot of reasons to make sure that federal employees are protected from the vicissitudes of Washington and of politics. These are clinicians. They should not be dragged into politics. Mm-hmm. So we get why the protections are there. But when our providers fail our veterans, we're going to hold them to account. And when we need to, we're going to move them out. And we've done that now in a series of very important scenarios. So our strategy, Robert, is hire more providers to make sure that we have the people to take on this care. Keep the good providers that we have, so we don't lose them to other higher paying healthcare systems. And third part of our strategy is get rid of the providers who don't live up to our standards. So that's our commitment, that's our strategy, we're going to stay on top of it.
Yeah, that's great. And even when you mentioned the PACT Act, with being able to provide bonuses for some of these physicians, that physician satisfaction has increased.
Yeah.
Is that true, right?
Yep.
Yeah, in the past year.
So we're tracking the e-signal, the employee signal, just as much as not as much, but we're trying to get the e-signal up as developed as the V-signal. Yeah. Sometimes the employee satisfaction and the veteran satisfaction go hand in hand. A lot of times they're the same side of the same coin. Mm-hmm. And so we want to make sure that we're investing in our people that way. And I will just say that, as we use these pay authorities, in some cases we're still not making our docs whole. If you're like a gastroenterologist a GI specialist at VA. Boy, you just have to walk across the street, you're going to make 3x what you can make at VA.
Yeah.
So what we're trying to do is not make them, we're not going to be the lead payer in any market. We can't be the lead payer in any market. We just want to be a degree or two more competitive. And these guys, when these docs, these nurses, when they come work with us, they're coming here because they want to work for you. They want to work for our vets. That's the whole purpose of coming here. Mm-hmm. So they're not in this for the money. So we don't have to make them fully whole. We just need to be more competitive, and that's what we're trying to do with these bonuses.
Key statement. They're here because they want to be.
Yeah, they're here because they want to work for vets.
That's right. Absolutely. Well, let's go to our last question. And this question comes from a military spouse, Dawn James. And she asked, why does it take so long to get an answer on a veteran's appeal? As a surviving spouse, I need the help of the benefit to make ends meet. It is very hard on one paycheck, which is Social Security Disability, also known as SSD.
Yeah. Don, thank you for the question. There's a couple of reasons why it takes so long. One is that we are now working through appeals from two separate systems. And the reason we're doing two separate systems is, frankly, the old system was so slow, we had to update it and modernize it. And so we're moving through this. And for for FY23, we made 103,000 decisions in the appeals court, the highest number ever. And that's really good. But it's only a start because there's 200,000 other appeals still there. And the average appeal takes somewhere between 12 and 18 months, which is too long. So as with the benefits claims that we talked about earlier, the main mover we have, the main lever we have in reducing the time it takes for appeals is to hire. So this has been a major priority since I arrived. We've hired more judges and more lawyers to help move those cases, to develop the cases and to move the cases through the system. We're going to continue hiring because we can anticipate as we get, as I said, almost 2 million claims in the year since the president signed the PACT Act into law. Mm-hmm. We can anticipate an increased number of appeals out of those. Even though right now we're granting at 77% for PACT Act claims, there's still going to be appeals out of that.
Yeah.
And so that line is going to continue to go until we have the right number of people working the cases, which brings me to my last point. And Don, I know you've got your hands full, would be my guess. But one of the ways we've been able to hire as aggressively as we've hired at the board in particular, but this is also true throughout VA, is that we lead the federal government in hiring active duty spouses to work at VA, particularly at the board. And I'm really proud of that fact. And when we say that, what do we mean? Well, the thing that's really important, and I'm not telling you anything, Don, but I want you to know, one of the attractions of hiring military spouses for us at the board is that as that teammate gets trained up and then maybe has to PCS to their next duty station, they just stay with us. Right? We're not making them leave, which too often is the case. So when we hire you at the board, when we hire you at VBA, the Veterans Benefits Administration, or at the Health Administration, or at the Cemetery Administration, in the right billets, you can stay with us through PCSs. We're really proud of that fact. I want Don and all of our other military spouses who are watching this to know not only we want to serve you better, but we also want to hire you. So we'll have some information on the screen there for you on how you could take that next step.
Yeah. Before we close, any last words?
No, just to be, I love being with you guys. Thank you. You know, we're, as a country, we rightly take November 11th every year to celebrate veterans. And when we celebrate veterans, we're celebrating some of the most determined defenders of the American democracy, the American democratic experience, the American democratic experiment of all time. That's for two reasons. One, because you veterans swore an oath and risked everything to protect the democracy. And we see that you continue serving long after you take off the uniform for the last time. You're likelier to vote than non-veterans. You're likelier to work in public service than non-veterans. In communities and towns across the country, as I've traveled, I've seen, including through things like the Fox Grant, veterans helping veterans. So you're more likely to look out for your fellow veterans. So when we're celebrating Veterans Day, we're celebrating veterans, your service in uniform, and your continued service to the greatest country on the face of the earth. And it's awesome. And it's a great blessing to be able to work for you here at VA.
Well, thank you for being with us today, sir. And thank you for fighting for veterans and their families. We truly appreciate it.
Thank you, brother.
If you would like to ask additional questions, veterans and their families can continue to approach the questions that they want to submit to us through Rally Point, where VA experts will be addressing questions on VA health and benefit services. So please visit the URL on the screen or search at rallypoint.com. Thank you for joining us today. Happy Veterans Day, everyone.